If you go to a clinic or hospital in Singapore, they will literally have a menu. It looks like a restaurant menu of everything they do and the prices.
Before we get into particulars how Singapore does it, the prices of a couple of procedures in Singapore versus the U.S. And it's important to understand, again, the quality is as good or better than the U.S. The doctors are paid as well as doctors in the U.S. when you take after-tax income. Singapore has a very low income tax system. Technology is high-tech. They don't skimp on technology. So quality of physicians, technology, equipment, everything, you can't say they're skimping on an area. So, but give us the cost of a couple of procedures, what you'd pay, what you'd be charged for here and what you'd be charged for in Singapore.
Okay, so I found several, a dozen or so of these that I could do price comparisons on for the book. And the one that really stood out for me, and this is partly as my father, before he passed away, had a quintuple bypass surgery, was that the average amount that a bypass surgery in the United States costs or bills out for is about $130,000. In Singapore, it's $18,000. And when you think about that, $18,000 is half the cost of a new car in America, right? New car in America, I think, hit $36,000 last year. Most people can buy a new car. Maybe they don't want the fanciest new car, but average people buy average cars. They can pay it off over 5 years. And so what Singapore has done in terms of financial security for individuals is they've taken what here would be a financial catastrophe. Who has $130,000 lying around? Very few people have that. Or they'd have to clear out their 401k or something, even if they've got some money saved up, or sell their house. It's a financial catastrophe for most families. But $18,000, that's something that people could pay off $200-$300 a month over 4 or 5 years, something like that. And so they've transformed what is a catastrophe due to their efficiency into something that's really inexpensive and just another consumer good, which is actually a good thing in this case.
So let's walk through the particulars of the Singapore system, where the government plays a large role, but somehow we get free market economics, a lot of competition. So describe the system, starting with what, if you are a person in Singapore, you must make mandatory contributions like we do with the FICA here in this country, but the difference being you control that money. Walk us through that, how they make this system work and where the consumer is in control. Even the government subsidizes that account.
Yes, so it's quite amazing. And the Singaporeans like to refer to the overall system as the 3 M's. And I'm going to talk, and M is in Michael, but the M's are MediSave, which is what you're referring to just now, which is their savings program for healthcare. There's MediShield, Shield being insurance. And then there's MediFund, which is a giant trust fund that makes sure that the indigent get equally good care to everyone else in Singapore. And so the first pillar is that MediSave. It's been in place since the early 1980s. And what it does is it requires people to save about 7% of their gross income into health savings accounts. The money is their personal property. If they die early or something happens, they can give it to their heirs and assigns. Once they reach retirement age, they can start transferring healthcare savings over into regular retirement savings where they can access it. And so everyone here knows that that's their own personal money, such that if they need a medical procedure done and it's their money and it's not third-party billing like it is here where someone else is paying the cost, they think to themselves, wow, I want to get this done right, but I want to get it done at the lowest cost. And then they go out into a healthcare marketplace, Steve, where price tags are mandatory. If you go to a clinic or hospital in Singapore, they will literally have a menu. It looks like a restaurant menu of everything they do and the prices. And they give you bundled prices. Like here, if you get an open heart surgery, you get 800 billing codes. There, they'll just say, here's the bundled price for the whole thing. Take it or leave it. And people can do this. You can go online in Singapore and comparison shop. Like if you needed a knee surgery, you could find out what every hospital in the country is charging. And then the government, to make it even easier to be a good consumer, publishes things like mortality, morbidity, and complication rates by providers. So you could, for instance, say, oh, this doctor over here is less expensive, but 1% of his patients die, whereas this other doctor over here, it costs more, but no one dies. And then, if you're like me, you'd probably go to the cheaper doctor thinking, 1 in 100, that's fine. And so The doctor who has sort of the lower quality and the lower price, he's under competitive pressure to raise his quality. And the doctor with the higher price and the higher quality, he's under competitive pressure to keep his quality up and lower the cost. And so in this way, there's competitive pressure for both price and quality of services.
And again, the outcomes there are better than they are here. And buying the insurance itself, do they buy it out of that first M? Or how does it work? You buy your own insurance. It belongs to you. So if you change jobs, it goes with you. It's your property, not the employer's property.
Yeah, I'm glad you brought that up, Steve, here, because due to changes in Obamacare, we've really restricted the use of health savings accounts here in America. And among other things, the money in them cannot be used to pay for premiums. And this is even true for people who are self-employed. Meanwhile, in Singapore, yes, people pay for their own health insurance premiums out of their own health savings accounts. So they're aware of the price of the insurance, which is great. And then they're also aware that under Singapore's system, and this is sort of the second stage, the MediShield part, the insurance part, it's high deductible insurance. So the first $2,000 a year of spending are on them. And so this puts sort of, you could call it sand in the gears, or you could call it just a little bit of friction, but it makes people pay attention in a way we don't have here.
Also, the insurance is age-related. So if you're a 20-year-old, you can get it for a few dollars a year. If you're 80 years old, it's going to be higher. But even so, with the competition where you're writing the check, the insurance premiums are a fraction of what we pay here.
Yes, well, it's startling. So, I'm 47 now. The health insurance policy my company is paying for is $20,000 a year, Scripps College. In Singapore, I could get this actually better quality insurance, right? Because you don't have to worry about in-network and out-network and all sorts of things. My insurance bill a year would be less than $1,000, which is another reason why these health savings accounts work so well, is that the costs of buying insurance and even the annual deductibles are for most people, unless something really catastrophic goes wrong, much less than the amount of money in their health savings account. And the government of Singapore actually guarantees the money 4% returns, so it's accumulating. Most people are quite healthy till they're about my age, right? So from getting out of high school or college, they'll work 20 years, just pile up savings. They're very healthy. And then what's really wonderful about this, and I had a father who was born in 1925, and so I've had to deal personally with the decline of a relative from robust health into, eventually death and senescence. But that is hideously expensive. Most healthcare costs are in the last few years of life. And the only country in the world that has money saved up to pay for the graying of the population and people getting older is Singapore with these health savings accounts. Whereas by contrast, Medicare currently has, I think, a $39 trillion hole in its trust fund over a 75-year planning horizon. And so we and Europe and Japan, even Korea, we're going to have to, unless we do some real reforms here, we're going to have to unplug Granny in 20 years, right? We're not going to be able, they're just going to start making really awful decisions.
Now, in Singapore, these savings, I'm not sure which of the M's they're parked in, or maybe they change over a lifetime, but they've saved up the equivalent, I think you've said, 5 years of healthcare costs. Now, healthcare is $3.6 trillion in the U.S., so if we had 5 years worth of healthcare costs saved up, it would be $18 trillion, a number that is so astronomical it's not believable. But in Singapore, 5 years have been saved up over the years. Cushion of 5 years.
And the money's still accreting, it's still growing. But yes, so an interesting comparison in the book is that I, as you pointed out, Singapore, there's so much money in these health savings accounts, they could run all healthcare spending in the country for over 5 years. That's all spending, public, private, everything could be paid for 5 full years with just the money in these health savings accounts. By contrast, there is so little money in health savings accounts in the United States that I ran the numbers, and for the most recent year, there was only enough money to pay for 13 days worth of healthcare services in the United States. So it's not even close. And so that's another way of saying they're so much better protected. They're hundreds of times better protected financially than Americans are.
Now, can you change your plan? I buy a plan from Company X at 22. When I year? Can I decide I don't like that? Can I change it? Is it easy
Yes.
to change plans?
Yes, you can. And so the way the government's been doing this is the government in Singapore sets what's covered and gives not exact but pretty restrictive rules to these insurance companies, or people are going to bid on them, as to what the insurance will cover and how much premium should be in this and that. And then they put it up to collective, not collective bargaining, what do we call it? It's sort of an auction process. And insurance companies actually bid on the right to be one of 5 companies that can actually offer these policies. And they have to compete with each other. They have to compete to even be in the game. And then,
how often must they compete to stay in the game?
I believe the auctions are held for the companies to get the rights every 3 years.
So if you win once, you've still got to perform, or you're not going to get it again.
That's right. And people can also, in the meantime, do something that I think is crucial in free markets, which is vote with their feet, right? Take their money, go to a different insurance company, and get a better deal. And so that's wonderful here. And people in Singapore aren't locked in to their health insurance for an entire calendar year, right? Here in November at most companies, you have a benefits fair and you sign up for healthcare that starts January 1 of the next year. And basically, if you change jobs or anything or lose your job in that time, you're in big trouble, because even if you have the money, it's cumbersome, even with, the things that Obamacare tried to do with these gold and silver and bronze plans, to go out and buy yourself new health insurance coverage. And so we have COBRA laws and all these other things to try and put a bandage on that problem. But as you point out, there's no problem in Singapore, where insurance is cheap, affordable, and there's options, and you could change at any time.